Hi there, I'm the neuromuscular mechanic, and today we're going to be talking about ultrasound for peripheral nerve block of the lateral pectoral nerve. Now, the lateral pectoral nerve provides innervation to the pectoralis major, so this blockade can be used as a diagnostic trial to gauge the impact of reduced pectoralis major tone on shoulder function. So if we go into the ultrasound, in this image here, I have the ultrasound probe transverse over the anterior chest. You have the pectoralis major on the top there as outlined in red, and then underneath it is the pectoralis minor, and you can see sort of the fascial planes between the two, and that helps with that distinction. And then underlying the pectoralis minor, you'll have the ribs and the underlying pulmonary structures. And so once you find this, you can move the probe until you identify these sort of circular structures in the fascial plane. And these structures, if we identify them, those are blood vessels. So if we freeze this image here, we have the blood vessels, and then just sort of beside them in that fascial plane is where the lateral pectoral nerve would reside. And so if we wanted to do a nerve block, what we could do is we could bring our needle in an in-plane technique, sort of line with where this red line is, down to that fascial plane, avoiding the blood vessels, and then we could use e-stimulation. And if then we see sort of a twitch to the pectoralis major with sort of the expected contraction, then we would know we're in the right place. And then you could deposit your medication, lidocaine or bupivacaine, and that would be sort of how we do those nerve blocks. So again, if we go now to sort of that dynamic imaging, again, as I move the probe laterally and medially, you can sort of see those two muscles again, pectoralis major on top, pectoralis minor below, the fascial plane where you can appreciate the vessels, and then sort of in that fascial plane besides the vessels is sort of where the lateral pectoral nerve can reside. Now, this is also a good image if you were thinking about doing chemodenervation. You could easily target the pectoralis major and minor using an in-plane approach and have a better understanding of where the underlying lung structures are. And so again, this can be useful as a trial to see the impact with reduced tone of the adductors. So I'm the neuromuscular mechanic, and I hope you found today's episode handy. Thank you and have a good day.